We used to see maybe one a month on a shift, and now we're seeing maybe one a weekend.
Stephen Samoilov has worked as an emergency doctor for years, so an overdose spike is no new thing for him. But he says the most recent spike, largely due to fentanyl, does have a unique quality.
I think this is a bit more devious, if you want to use a word. We're hearing stories of regular users who are overdosing when they thought they're taking their normal dose.
In the emergency department, Samoilov says his and his co-workers' experiences do have their differences from that of paramedics or firefighters on the streets.
We're getting the survivors. We're getting the people that have been resuscitated by the first responders. I think it's much more stressful on the fire and the police and the bystanders and the friends and the family that are actually seeing it go down.
After a naloxone dose, a patient can become irritable or worse.
We've seen people that have gone outright combative to start fighting the first responders and turn into a dangerous situation.
The other issue, patients often want to leave the hospital after they've had their naloxone dose.
There's an issue with naloxone in that it lasts 45 minutes to 90 minutes in your system, but the drug you took may in fact be lasting longer than that.
In the emergency department, Samoilov says overdoses take priority over most other calls.
We consider an overdose situation a critical case that would get us all to stop what we were doing. We'd have at least 2 nurses and 1 physician dropping what they were doing and responding to the case.
Samoilov also wants to remind people that naloxone isn't the be-all, end-all for overdose response.
Even if you can't get your hands on a naloxone kit, mouth-to-mouth or chest compressions could be life-saving.
For Castanet News, I'm Dustin Godfrey in Penticton.